Hey everyone, and welcome to This Explainer. So today, we're diving into something that literally touches the daily lives of so many families right here in Hyderabad, and specifically over in the Nallakunta area. We're talking all about teen orthodontic solutions. Now, if you're a parent, you already know that the teenage years are just this absolute whirlwind of development, right? Physically, emotionally, the whole shebang. And a huge part of that emotional development is completely tied to their self-confidence. So today, we're going to look at how modern dental technology is just completely transforming how we approach teenage smiles. We're talking about moving far away from those uncomfortable methods we all grew up with and stepping into something that is honestly, truly incredible. Okay, let's dive into this. Here is our quick roadmap for exactly what we'll cover today. First, the teenage smile struggle. Second, enter the teen aligner. Third, braces versus clear aligners. Fourth, the 6-step treatment journey. And finally, next steps at Apollo.
All right, let's kick things off with Section 1, the teenage smile struggle.
You know, it usually starts with those little things we parents might totally miss at first. A super tight-lipped smile in the family photos, a hand that quickly flies up to cover their mouth right in the middle of a laugh. Or maybe they just suddenly start dodging the camera altogether. When a teenager feels self-conscious about their smile, it really takes a hidden toll. It's not just about aesthetics here, it actually chips away at their core confidence. It affects how they show up in classrooms, how they interact on the sports field, and how they navigate those tricky social settings where, let's face it, those vital first impressions are made. It is a really heavy burden for a teenager to carry around every single day.
So, this brings us to a crucial question: what makes teen aligners different? I mean, for decades, the only answer to a crooked smile was clunky, highly visible metal braces. They were kind of this uncomfortable rite of passage, and often a pretty embarrassing one, right? But the really good news here is that today's orthodontic solutions have leaped out of the dark ages and into this nearly invisible, highly advanced future.
Which brings us right into Section 2, enter the teen aligner.
Now, what's really interesting about this is that teen aligners are not just random pieces of plastic. They're actually this brilliant series of clear, removable trays made from high-tech, medical-grade material. But the real magic, it's in the precision. Each individual tray is custom-built based on a remarkably accurate digital 3D scan of your teen's mouth. So the teen wears a set, and it just incrementally, gently shifts their teeth before they swap to the next tray a week or two later. It is a completely customized, digitally mapped journey from start to finish.
But listen, they aren't just scaled-down adult aligners. They are specifically designed for real, messy adolescent life. Let me reassure any anxious parents watching, the people who make these absolutely know teenagers. First up, they have compliance indicators. These are these little blue dots on the aligner that literally fade away as the teen wears them. This means you and the dentist can instantly see if the treatment is on track without turning every single appointment into this stressful interrogation. Second, they've got eruption tabs. Teenagers are growing, they often still have teeth coming in, and these tabs act like little built-in space holders for those new teeth. And finally, extra replacement trays are included because, let's be real, teenagers lose things. It's just a fact of life, and this system accounts for it seamlessly.
All right, let's move to Section 3, braces versus clear aligners.
And this brilliantly illustrates the old way pitted against the new way. I mean, look at the contrast here. With traditional braces, teens face this miserable, long list of forbidden foods. No popcorn, no sticky sweets, no biting into apples. But with aligners, zero dietary restrictions, none. You literally just pop them out to eat, enjoy whatever meal you want, and pop them back in. And appearance-wise, braces mean highly visible metal brackets catching everyone's eye. Aligners are made of transparent plastic that sits flush against the teeth, making them nearly invisible. That is a massive daily relief for a self-conscious teen. Comfort-wise, metal wires can cause really painful ulcers. Aligners? Smooth, rounded edges. And finally, cleaning. Trying to floss around metal brackets is a nightmare. With aligners, your teen just takes the tray out and brushes and flosses completely normally. A total game changer.
Now, I hear this all the time. There's this huge myth that clear aligners can only fix minor cosmetic stuff. Actually, scratch that, it's a total myth. With today's crazy advanced digital planning software, teen aligners in Nallakunta are clinically proven to treat highly complex conditions. We're talking crowded teeth where there just isn't enough jaw space, gaps between the front teeth, overbites, underbites, crossbites, and even open bites where the front teeth just don't meet. As long as they are worn as prescribed, they are every bit as effective as traditional braces for these conditions, no question.
Moving right along to Section 4, the 6-step treatment journey.
Let's move to and see how this builds step by step over at Apollo Dental Clinic just to demystify the whole thing.
Step 1 is the initial consultation, complete with visual and X-ray checks to make absolutely sure aligners are the right fit. Step 2 is a super quick 3D digital scan using their iTero Lumina, so no gagging on messy putty, thankfully. Step 3 is custom tray fabrication based on that exact scan. Step 4 is when the actual treatment begins, which requires about 20 to 22 hours of daily wear time. Step 5 means quick periodic check-ins every 6 to 8 weeks. And finally, Step 6 is retention, where they'll wear a night retainer just to lock in that beautiful new smile.
Now, timeline-wise, every family always wants to know what to expect. Get this. Visible changes actually start happening incredibly fast, often within just the first 1 to 4 weeks. For mild cases, you could be looking at dramatic improvement in just 4 to 6 months. The average treatment window spans about 6 to 18 months, with the more complex cases generally resolving in that 12 to 18-month range. But honestly, the ultimate result isn't just about the timeline. What families consistently report back to us is seeing a teenager who finally speaks with confidence and smiles without holding back.
I actually want to pause on this quote derived from the clinical research for just a second, because it hits the nail right on the head. Adolescence is a formative period, and a smile that a teen feels good about can genuinely shape how they navigate that phase of life. The psychological benefits of this treatment are just so well documented. We aren't just shifting teeth around here, right? We are literally removing a barrier to a teenager's self-esteem during some of the most vulnerable years of their life.
Which leads us perfectly into Section 5, next steps at Apollo.
So, the crucial point is knowing where to find this high level of care locally. If you're a family in Hyderabad, anywhere from Nallakunta to Secunderabad, the premier destination for this journey is Apollo Dental Clinic, super conveniently located right on Shivam Road in New Nallakunta. They are incredibly well regarded for combining top-tier clinical precision with genuinely patient-centered care.
Let's break down exactly why Apollo Dental Nallakunta stands out from the pack. First off, the clinic is led by Dr. M. Ravi Teja. He's a highly experienced MDS specialist in orthodontics with over 9 years of practice under his belt. Plus, they're one of India's largest Invisalign providers, and they operate with that in-house iTero Lumina 3D scanner we mentioned. That is a highly advanced piece of tech typically only found in premium dental institutions, which guarantees your teen's trays fit flawlessly from day one. They also have multiple dental specialists under one single roof, so you never have to deal with the headache of outside referrals. And, absolutely crucially for us parents, they offer flexible EMI options to make the whole investment totally manageable. Now, before you even begin, I've got to share these fantastic practical success tips pulled straight from the source material to empower you and your teen. First, have them set daily phone reminders for their wear time. Second, and this is a big one, always have them carry a bright-colored case in their school bag. The #1 way these things get lost is by getting wrapped in a napkin on a cafeteria tray. Make sure to remind them to rinse the aligners after removal to keep bacteria at bay. Ensure they never skip those 6 to 8 week checkups. And finally, just encourage them to communicate honestly with the dentist if anything feels off or uncomfortable.
And guys, here is something absolutely crucial every parent needs to hear today. The ideal window for this treatment? It's right now. Literally. You might be thinking about waiting a bit, but the teenage years are actually the absolute best time for orthodontic work. Why? Because their jaw is still actively growing. This means their teeth are going to respond to movement much faster and way more easily than they ever will once they hit adulthood. So that brings us to one final thought, a question really, for you to chew on. Are you ready to help your teens step into their most confident chapter yet? An investment in their smile is truly an investment in how they present themselves to the world for the rest of their lives. If you're in the Nallakunta area, Apollo Dental Clinic is just minutes away and they are accepting new patients right now. You can easily call or WhatsApp them to schedule that very first 3D consultation. Thank you so much for hanging out with me for this explainer, and hey, here's to a future full of bright, completely confident smiles.